Hopefully you have a good day in between corona quarantine. But don't worry about the virus if you keep your body healthy and stay at home. And don't forget to always wash your hands. My name is Tasha. Today we're going to learn about 5 topics in medical nursing. Let's get to the list. First now, we're going to take a walk to 5 rooms in the hospital. First is maternity unit. The maternity unit is a consultation room for maternal care from pregnancy to childbirth. In this unit, pregnant mom will check their womb and prepare for the birth baby. Usually in this unit, there are uterine examination tools such as USG, fetal Doppler, etc. for measure the pregnancy period. The second is pediatric ward. The pediatric ward is the ward that they care for children in many hospital areas, including labor and delivery, and the pediatric intensive care unit. In this ward, there are so many decorations and items that support the healing for children, such as toys, learning places, playgrounds, etc. that makes children happy in the hospital and doesn't bother the treatment. Third is radiology department. The radiology department is the medical discipline that uses medical imaging to diagnose and treat disease within the bodies of animals, including humans. A variety of imaging techniques, such as X-ray radiography, ultrasound, computed tomography or CT scan, nuclear medicine including positron emission tomography or PET, and magnetic resonance imaging or MRI, are used to diagnose or treat disease. Fourth is pharmacy. The pharmacy is to provide all inpatient and outpatient pharmacy service, including dispensing, preparation of non-sterile and sterile commodities as required, conducting clinical trials as needed, reporting on adverse medication reactions, and the provision of medication information and education. The fifth is surgical ward. The surgical ward is the ward caters for patients undergoing a wide range of general and complex surgical procedures. During the surgical process, doctors and nurses will use surgical equipment. Next, I'm going to tell you about 5 medical equipment in the hospital that usually used. First is stethoscope. The stethoscope is the equipment that usually used by doctors or nurses to check heart rate or other body parts such as patient's stomach or back. Second is thermometer. The thermometer is the equipment that usually used to measure your body temperature. The normal body temperature is about 36 to 37 degrees centigrade. If your body temperature is above 36 to 37 degrees Celsius, then you should go to the hospital or call the coronavirus hotline. Third is aneroid manometer. Aneroid manometer is used by medical professionals to measure blood pressure, which is the first extract of the walls of the artery as the heart pumps blood around the body. Fourth, medical scissors. The scissors is designed to use by medical professionals in their facilities by cutting materials such as suture, skin tissues, bandage, clothing, and any other materials that need immediate access. Fifth is plain dissecting forceps. They are more commonly used as an extension to the user's grip in holding tissues, sutures, and needles. Next, after we know about medical equipment, now you have to know about how to use that equipment, right? I'll not mention 5 equipment that we talked before. I'll just describe one equipment and 2 check procedures of blood pressure and pulse rate. For blood pressure, I'm going to use this manometer. Then for pulse rate, I'm going to use my hand. Then you have to try with your hand. Okay? First is check blood pressure. So the procedure is you have to roll up your patient's sleeve. Then you have to wrap this around to his arm. Then you put this stethoscope between his arm and the cuff manometer. Next step, you have to find her pulse on the wrist. And if you found it, you pump some air with this pump into it until the pulse feels like disappear. Then you add 30 dial bars. Then release the air of the pump and listen from the first heartbeat to the end of the heartbeat. And then that is your blood pressure. The normal blood pressure is 120/80. Second, to check your pulse rate, you have to use your hand or your friend's hands, patient, or someone else. Pulse rate is the procedure to measure pulse. Is that normal or not? You can place your 2 fingertips at this point. The wrist just below the thumb, and feel the beat. The average human pulse rate is about 60 to 100 times per minute. Next, guys, do you have certain health problem? I have one. This is stomach problem, or called gastritis. Gastritis is stomach disease that is inflammation. So if you have the same health problem as me, I want to explain you about how to manage your food if you have a gastritis. First, follow an anti-inflammatory diet. You can consume a diet that helps you minimize inflammation and provide relief over time. So you have to manage your food. Two is drink green tea with honey. Drinking green tea or black tea at least once a week could significantly reduce the prevalence of H. pylori, the digestive tract. Third, eat lighter meals. Eating lots like carbohydrate-heavy meals can put a strain in a person's digestive system and aggravate gastritis. Eating small meals regularly per day can help ease digestive process and reduce the symptoms of gastritis. Fourth, reduce your stress. Stress can cause gastritis flare-ups, so reducing stress level is an important way to help manage the condition. Keep happy, guys. It really works. The fifth, the most important thing is don't skip your meal times. Next, the last topic. Now we're going to know about how to use medication and the function of these two medications. The first one is paracetamol. Paracetamol is the one of several painkillers that rarely cause side effects. This medication is pain reliever and fever reducer. This paracetamol is used to treat many conditions, such as headache, muscle aches, arthritis, backache, colds, and fever. I usually use this when I got a fever or sometimes headache, and I take this medication for 3 times a day after meals. Second is bioplacentan. Let's open it. Oh, there's a label, guys. Can you see it, guys? The labels? Here we go. Indication. Bioplacentan is indicated for healing of burn, infected wounds, scars, and skin ulcers. Contraindication. Patient with history of hypersensitivity to any components of bioplacentan. Dosage. Apply a sufficient quantity of the jelly on the wound surface 3 to 5 times daily as required. Warning: discontinue use if sensitization occurs. Use of neomycin sulfate for prolonged periods may result in secondary infection. Do not use bioplacental on eyes or skin around the eyes. This medication should be used only when clearly needed during pregnancy or lactation. Okay guys, that's it. 5 topics for today. Did you learn about new things? Yes, we have to learn about new things every day. So if you like this video, click likes and comment below. See you in the next video. Bye bye.